Hi, I'm Dr. David Hill, and today we're going to talk about how to treat chest congestion at home. Now, the first thing we want to do is define what chest congestion is. Usually we're talking about kind of a harumphy cough and maybe even a rattling sound, usually in the setting of a cold with a runny nose and stuffy nose, all that stuff coming together. If you hear a high-pitched sound, we call that a wheeze. That's not just chest congestion. That could be a sign of a very serious or even life-threatening asthma attack, and for that your child needs to see a doctor immediately because there are some very effective medications that can help with that. Likewise, if your child is actually short of breath or having chest pain, that child needs to be seen urgently. That's more than just a little bit of a cold. But if your child's got a runny nose, stuffy nose, hacking cough, up at night, that's chest congestion, and it may be a combination of mucus dripping down from the sinuses and the nose and mucus that's generated in the lungs. When a virus gets into the lungs, it can create mucus and cough for up to 3 weeks in a row. We have found, first of all, that medications really are not particularly effective for cough or congestion in children, especially young children. Some of the medicines we used to recommend, like dextromethorphan, which is in Robitussin and Delsym, we now realize never have been shown to stop coughing in children or do very much. Likewise, cough and cold combination products and decongestants are no longer recommended for children, and especially for children under age 6 years, where the risk for side effects is especially high. We have found some things that help. For cough, for example, honey. Your grandmother or great-grandmother's recipe, a spoonful of honey, doesn't just help the medicine go down, it is the medicine. It actually works better than cough medicine to suppress cough in children. A humidifier may also help loosen secretions, keep them moist, and make it easier for a child to cough up whatever gunk is dripping down into their lungs. It may help them sleep a little better. Patting on the child's chest, gently, not terribly forcefully, might help loosen some secretions and help the child get some of that gunk up and sleep a little better as well. If the secretions are coming from the nose, there is a medicine in children over age 6 that can help cut down on nasal secretions. It's generic. It's called ipratropium. The brand name is Atrovent, and it comes as a nose spray. Your doctor may be able to prescribe Atrovent nose spray to improve your child's postnasal drip. Likewise, if the congestion is a result of allergies, antihistamines like loratadine, loratadine Sclaritin, or cetirizine, which is Zyrtec, may help. Those are over the counter. Or your doctor may prescribe prescription allergy medicines, especially nasal steroids, that can make an enormous difference in your child's symptoms. So consider what the source is. Now, if your child has had a fever more than 3 days, or a fever that went away for greater than 24 hours and came back, that may suggest a sinus infection or even a pneumonia. Those children really should be assessed immediately. So, talking about treating chest congestion in children, I'm Dr. David Hill.